Good morning all. I am Dr. PJ Madam Rafi. Today we are going to discuss about NSAIDs and their classification and their uses. Okay. So first of all, what is the classification of NSAID? NSAID will have be classified into three groups, that is non-selective COX inhibitors, preferential COX inhibitors, selective COX-2 inhibitors. Okay. So non-selective COX inhibitors, in this non-selective means obviously they will inhibit both, that is inhibit COX-1 and COX-2. Examples like paracetamol and salicylate. Preferential COX-2 inhibitors means they inhibit more COX-2 comparatively COX-1. Okay, that means they will inhibit more comparatively COX-1. Okay, so in this group we will have examples like nimesulide and nabumetol. Next, selective COX-2 means obviously they will inhibit only COX-2. Okay, in this group we will have examples like celecoxib, rofecoxib, valdecoxib, etoricoxib. Okay, so these drugs are very important. If you are having COX in the name, means those are selective COX-2 inhibitors. Okay, so first we will see examples like non-selective COX inhibitor, that is paracetamol. Okay, so paracetamol is also known as acetaminophen. Actions have like antipyretic, analgesics. Okay, analgesics action will be, it will activate as mainly on vanillide receptors. Okay, that is TRPV1 receptor in the brain. So there how it will produce analgesic effect. Okay, this paracetamol will have only two, antipyretic and analgesic. It doesn't have anti-inflammatory activity. This is an MCQ. Okay, if we are normally kept anti-inflammatory activity also, but paracetamol doesn't have anti-inflammatory, only antipyretic and analgesic effect. Okay, it will metabolize and will produce one toxic agent, that is NAPQ. NAPQ nothing but N-acetyl para-aminobenzoquinone. Okay, this is a hepatotoxic. Okay, toxic metabolite. Okay, so when you are having more dose means paracetamol toxicity, obviously we will give antidote like N-acetylcysteine. Okay, paracetamol poisoning will be not most common, but when patient is consuming more, obviously more like 10 gram like that per kg body weight, so obviously it will cause toxicity. So in those patients we will use antidote like N-acetylcysteine. Okay, next will be salicylate. Next is also non-selective COX inhibitor. Okay, in salicylate will the examples like aspirin. It is a irreversible inhibitor of COX. These actions will be antipyretic, analgesics, anti-inflammatory, antiplatelet. It have four effects. Okay, paracetamol will have only two, that is antipyretic and analgesics. Along with that one, this aspirin will have anti-inflammatory and antiplatelet also. Okay. So what is the aspirin main action will be antiplatelet. How they will have antiplatelet effect means they will inhibit thromboxane A2 and COX enzyme also. Normally thromboxane A2, because platelets will produce thromboxane, right? So once you are inhibiting this by thromboxane enzyme. So once you are inhibiting thromboxane enzyme, there will be no production of thromboxane A2. Okay. This thromboxane A2, obviously when there will be inhibiting of thromboxane A2, decrease platelet aggregation. Okay. Why means thromboxane is a potent aggregator of platelets. When you are inhibiting thromboxane A2 production, obviously it will decrease platelet aggregation. When it is decreasing platelet aggregation, it will be useful in some prophylaxis conditions like MI-CAD patient will use. Okay. Next one is one more action also it will there. It will inhibit COX also. Okay. COX, when we are inhibiting COX, obviously prostaglandin I2 synthesis will be decreased. Okay, this prostaglandin I2 will have enhanced aggregation. Okay, that is, it will increase. When we will already discuss this thing in prostaglandin class. Okay, there these things have, these both are contra actions. Okay, thromboxane will aggregate, prostaglandin will decrease aggregation. Both are contra. When you are inhibiting these two, okay, thromboxane A2 and prostaglandin A2, when you are inhibiting thromboxane A2, obviously it will decrease aggregation. Okay, that means when you are inhibiting prostaglandin I2, it will enhance aggregation, but the effect will be thromboxane A2 effect will be more. Why means it is having major effect. What is the reason means these are antiplatelet drugs, right? Aspirin is an antiplatelet. It will be given in oral route only. Once we are giving oral route, it will undergo first pass metabolism. Yes or no? When you are undergoing first pass metabolism, it has to enter into the liver. Okay. These platelets will expose more in the liver. Okay. So obviously it will act more on the platelets. That is thereby obviously less amount will be released into the systemic circulation. That's why prostaglandin I2 effect will be less. Okay. That's why they will have minor effect, because aspirin will produce more action on platelets in the liver itself. That's why it will be having decreased platelet aggregation. That will be, it is having major effect. Okay, that's the major difference. Next one will be adverse effects. Okay, adverse effects of salicylate. It will cause obviously metabolic acidosis, prolonged bleeding time, because they will decrease platelet aggregation. So once bleeding start, obviously bleeding time will be prolonged. Hyperuricemia, so you can avoid in gout patients. Next, contraindicated in children because of developing race syndrome. Okay. Next important thing related to the salicylate is salicylate poisoning. Obviously, once patient will develop salicylate poisoning, we will do gastric lavage, correction of metabolic acidosis, urinary alkalization with soda bicarb. Okay. Next group will be preferential COX-2 inhibitors. Preferential COX-2 inhibitors will have drugs like nimesulide. Okay, it is a potent hepatotoxic. Next group will be nabumetone group. Okay, nabumetone is a basic drug. Normally, all this group, that means NSAID group, will have acidic drugs. Okay, except nabumetone. Nabumetone is a basic drug. Rest of all drug will be acidic drugs. Okay, that's the main important. Next is selective COX-2 inhibitor. COX-2 selective means it will be acting on only COX-2. Okay. So the examples like celecoxib, etoricoxib, paricoxib, lumiracoxib. Okay. This name itself consists of COX. Okay. If the name itself consists of COX, means it is a selective COX-2 inhibitor. It will have very little gastrointestinal toxicity. In this group, some drugs will have chance of rethrombosis. Okay. If you are using long term. So what are those drugs will be already withdrawn from the market. They may have chance of asking these drugs. Okay, that's why I'm mentioning here. Proficoxib, valdecoxib. They are already withdrawn from the market because of they have chancing of thrombosis, rethrombosis, if we are using for long term. Okay, so this is regarding NSAIDs. Okay, that's all. Thank you.